The DRSABCD action plan provides the first aider with a tool to follow when approaching the scene of an accident or emergency. The plan provides a prioritised series of actions where each letter represents a step to be taken in the care of the casualty. Each step is to be completed before moving on. D represents the danger to look out for in first aid situations. It is important to check for dangers to yourself, the casualty or bystanders. You are no help in a first aid situation if you become a casualty yourself. Particularly, be aware of dangers such as oncoming traffic, fire, fumes, blood or electricity. If possible, remove the casualty from the danger or the danger from the casualty, and only continue if safe to do so. If the danger cannot be removed, wait for emergency services. R represents the response of the casualty. Is the casualty conscious or unconscious? Assess the casualty's response by talking and touching, ensuring the touching does not aggravate any injury. Give a simple command such as open your eyes or squeeze my hand.
Can you open your eyes for me?
Grasp and squeeze the shoulders firmly. If the casualty responds to you meaningfully, then they are conscious. So continue with the next letter of the DRSABCD action plan. Manage any injuries and treat for shock. However, if there is no response to your touch or questions, the casualty is unconscious.
Chloe, he's unconscious. Can you please call 000?
S represents you or a bystander sending for help. 000 should be called for all unconscious casualties.
Ambulance, please.
You should stay on the phone line, speak clearly, and answer the operator's questions.
Permian Park, Hampton East South Road.
A represents airway, the passages down to the lungs. Open the unconscious casualty's mouth and check for foreign objects, such as food or vomit. If food or vomit is found in the mouth, you must immediately turn the casualty onto their side and clear their mouth with your fingers. When the airway is clear, lifting the chin upwards and tilting the head backward are critical skills to open the airway. The pistol grip is used because it lifts the tongue off the back wall of the throat. An unconscious casualty is in danger because the tongue often flops back against the throat, blocking the airway and stopping air from entering the lungs. Working beside the casualty, place one hand on the forehead. The second hand is positioned with the thumb around the chin and the index finger extended along the jawline. The other fingers are tucked under the chin so as not to put any pressure on the throat and neck. The jaw is now lifted upwards to the ceiling, causing the head to be tilted back, but not the neck. The pistol grip is used for people of all ages. However, the degree of head tilt will differ with a person's age. In an infant aged 0 to 1 year, the head is positioned neutrally. Because their airways are small, tilting is not used as it may cause an airway obstruction. Ensure that the nose is also clear. In an adult or a child, a full head tilt is required. However, in deciding how far to tilt the head, you need to be guided by the size of the child rather than their exact age. B represents breathing. Look for the chest rising and falling. Listen for the sound of breathing. Feel the air from the casualty's nose or mouth on your cheek. Feel and look for movement of your hand on their abdomen. Breathing should be checked for at least 10 seconds. If a person is breathing, their heart will be beating. And because they are breathing, it is now time to turn the unconscious casualty onto their side. This side position helps maintain a clear airway, allowing the tongue to move forward in the mouth, facilitating drainage of any fluid and reducing the risk of inhaling foreign material. When turning an unconscious casualty, handle them gently. Avoid any twisting of their head, neck and spine. If a person is in a wheelchair or trapped, for example in a vehicle, and the airway is open and breathing is present, they can be managed without attempting to move them. Airway and breathing come first, and managing any other injuries, including a spinal injury, is second. If the unconscious casualty was not breathing or not breathing normally, you would commence cardiopulmonary resuscitation. However, in this action plan, our casualty is unconscious and breathing. Therefore, we move to C. C represents circulation. As the casualty is breathing, we know their heart is beating, so they have a pulse. Observe for other signs of circulation such as skin colour and skin warmth. D represents deadly bleeding. Check for external bleeding, pooling or spurting blood loss. Control external bleeding using the principles of pressure and rest. The Australian Resuscitation Council has stated there is no evidence that elevating the bleeding part will help control bleeding, and there is potential to cause more pain or injury. Check for internal deadly bleeding by looking for bloody fluid coming from the ears, as this may indicate a possible fractured skull. Tenseness in the abdomen and thighs indicate there may be bleeding from the internal organs and major blood vessels. With the DRSABCD action plan complete, and whilst waiting for the ambulance to arrive, you should frequently check the casualty's airway, breathing and circulation. Keep the casualty warm and manage other injuries. Also check pockets or accompanying bags for identification and any medications.
We just found some jelly beans and they were in his pocket.